Well, Doctors Without Borders says governments should prioritize COVID-19 prevention among the elderly and those with chronic illnesses. The organization has been working on raising awareness in these age groups. Rod Gerstenhaber is from Doctors Without Borders Southern Africa. He joins us now from Coboda in Spain. Rod, good evening, and thank you so much for your time. Interesting that you're talking about those that are at high risk this is in terms of COVID-19. What preventative measures do you think could be implemented?
Hi, good evening. Hopefully you can hear me. With the COVID epidemic, as we've seen that there are large case numbers, particularly now spiking in Gauteng, and it's not in the sense there's a lot of community transmission happening. What we've seen is that mortality really does strike much harder on the high risk groups, elderly, people that have diabetes, people that have hypertension and cardiac problems. So these people are really the ones that are at most risk for severe consequences of COVID, and therefore they're the ones that need to be prioritized. Prevention measures are the same in the sense that masks, social distancing, and hand washing, they're all the same, except that it becomes very complicated when individuals when they share households, particularly small households in townships, where there are young individuals and these high-risk individuals, and there's not a lot of space where one can take measures. So it becomes a challenge, but it needs to be in the mind of people that there are certain groups that are much more likely to suffer severe medical consequences of COVID, and those are those high-risk groups: the elderly, diabetes, hypertension, and as well we've also seen that tuberculosis has a mortality which is double that of people that don't have tuberculosis. So we do need to take care of those people that are at risk.
The issue that you're raising, especially around space, of course, affects so many South Africans, and an intervention would almost have to include removing elderly people physically from the spaces that they live in, those confined spaces that they live in. In the absence of that doing, are there things that families can be doing differently in order to protect the elderly that they live with? We also know that in Southern Africa in particular, there are a lot of child-headed households which are taken care of by elderly grandmothers and even grandfathers.
Yeah. It's true. So there's a whole spectrum of initiatives that people can take. Removing people from the home and locating them in another location is, as you mentioned, the most let's say intense action that can take, and also difficult, unlikely, particularly if the household is led by an elderly person, grandmother or grandfather. But it's every household has just its own particular circumstances. In circumstances that are where it's possible, it'd be nice to have maybe like one small room that could be allocated to someone, or if it can't be an entire room, a portion of that room where a high-risk individual. It's not just the elderly, although the elderly are highly at risk, but it's also as well people that have comorbidities, as I mentioned. But if someone can be allocated, even if it's a portion of a room, and then precautions just need to be taken. I mean, it's up to that family to see if they're able to use masks in the household. It's up to them if they're able to improve circulation of air. It's up to them to see how many resources can be allocated. Obviously, it's a huge challenge, but it's about being aware of reducing the interaction with those individuals as much as possible, because we don't know. That's the same reason we ask everyone to wear masks. You don't know if you have COVID, because you could be asymptomatic, not have any symptoms whatsoever. You could feel perfectly fine in some cases. So mask wearing is to prevent you transmitting the disease unknowingly to anyone else. And this sort of activity in the house should be the same. You try to reduce the interaction as much as possible. There's no particular magic formula, but each household should be looking at what they can do.
Of course, one of the hotspots has been the issuing of grants, especially for the elderly, where we know many of them queue up to receive those grants, and even that becomes an incredible risk for them.
Mm. So, I mean, queuing can be done responsibly. Hopefully, people are looking at 1.5 to 2 meter distance. I'm not so sure it's happening as on the ground. But yes, these people are asked to at least monthly leave and find the grant and interact with the people in the SASA office. So I don't know what alternatives the government has allowed. If anyone would be allowed to collect a grant. On someone else's behalf, for example, another family member, that may be helpful. But the best thing is if anyone, and particularly a high-risk person, has to leave the house, they should follow all the precautions that they can. So mask wearing, social distancing, hand washing, interact, don't touch things, don't do that, and reduce as much as possible. I don't know, like I said, I don't know if there's any alternative in the sense that the government would allow them not to physically go and they could still collect the money.
Of course, one of the challenges now is that with all of the attention on COVID-19 and the wariness of people to go either to hospitals or even to their local GP, just out of fears of contracting the virus, means that the treatment of other chronic illnesses is almost falling by the wayside.
Look, I think there are two reasons why it's possible that HIV services, TB services, and testing have decreased. One is on the health system side. It's clear they're struggling, and there's a lot of attention at the health system, at the health center, at the hospitals, on COVID patients, on diagnosing COVID, on treating COVID, and of course that's important. But it's important also that healthcare workers are reminded that HIV services, TB services, other essential services also need to be functioning. But as you mentioned, there's also this sort of fear from the user about going to seek services, and I think in this case, one has to say that if the sort of possibility of catching COVID is a reality, but still people need to seek medical care. I think it was said many times. So if someone believes that they need to seek medical care for whatever reason, if they believe that they have a respiratory problem, if they have difficulty breathing, if they have a chronic condition that's not being well managed, people should access the health centers. Health centers have taken measures to try to reduce to the maximum the amount of people that have COVID-like symptoms or flu-like symptoms entering. So at many health centers, you find that there's a screening point, or some call it a flu clinic, and MSF has supported this type of initiative both in the Western Cape, in Khayelitsha, in Ishawe, in KZN, and therefore the people are screened, and even sometimes the ailment that they came to complain about for the health center can even be dealt with right there, so that people don't have to access the clinic. So there are things that are happening that try to reduce the risk, but people should go for TB care, for TB testing, for HIV testing. And I believe that the health center will do their best to reduce the risk of exposure.
All right. Rod Gerstenhaber is from Doctors Without Borders, Southern Africa. Thanks for your time tonight.